collect on therapy use. This information, as well as your feedback, helps them evaluate how you are using and responding to therapy. Good information about your progress can help your healthcare team develop specific strategies that will benefit you. By becoming an active participant in your treatment team, you will learn how to accept, tolerate, and respond to PAP more quickly, and begin enjoying the full benefits of effective therapy.
For many people, the first few weeks adapting to positive airway pressure are the most challenging. So I asked our panel of OSA patients to share their experiences. I'd like to thank all of you for coming today and sharing your experiences about OSA and CPAP therapy. We'd like to welcome Lanita and Dave Myers, Raul Guevara, Dr. Matthew Abraham, Peggy Jennings, and Dee Stanley. Is there anything that you wish you knew before you got your treatment that you think would have made your transition easier?
Well, I think it was just initially with the whole idea of thinking that I might have it, but once I learned more about it and realized that all the diseases that could be caused because of it, I looked at the big picture, and there really wasn't too much to really adjust to or overcome. And on top of that, I was getting a great night's sleep. So it was a pretty easy transition, not much to overcome.
Once I started acclimating and getting better with the treatment, the benefits were significant. And it really made a significant improvement in my life.
Some people adapt quicker than others. But I think that's one thing, if you just think about it, that you woke up and it's on the floor, that's not necessarily mean you can't wear the therapy. It means pick it up, put it back on, and as we'll say, Matt uses a word, we tend to use it all the time, acclimate. You gotta acclimate to therapy.
I was concerned only in the sense of a machine coming to the house. Machine makes it appear noisy.
Oh, sure.
Okay, and that was not the case. The machine is actually, it is a hum, and it's white noise. And I am a very light sleeper, as I mentioned before, and it was very easy to adapt to.
What were some of the issues that you faced, and how did you address them?
Had some problems initially as far as getting congested, and I went to some humidity that way. And where we live in the East Coast, you tend to, wintertime, you might need a little more moisture than you do in the summertime. In summertime, we do get some nice humidity, and I can go without adding the heat or even the humidifier sometimes.
In his first few weeks of therapy, he would go to sleep with it on,